risk factor is age, is sex, is marital status, all are blamed to cause back pain. I don't know what to avoid. Then occupational factors, persons engaged in different heavy activities, persons involved in long sittings are usually the sufferers of this back pain. Then general health factors like smoking, like obesity, like different dietary factors are also said to cause back pain. And when I try to avoid these risk factors, I usually find that there is no solution at all. Then the genetic factors, again, we don't have a solution at all. So that is the problem. Knowing these factors or not knowing these factors does not put any effect on the management of this disease. Next. Then the diagnostic workup is so complicated. It is difficult to find the way out. The problem with the diagnostic confusion is they occasionally identify serious pathology that may be responsible for symptoms of low back pain and requires urgent and targeted intervention. The present day medical management is based on pathology model of disease treatment. Whenever we find a symptoms, patient present to us, then we start finding to any tissue pathology by our clinical workup and by diagnostic workup. And if we don't find anything, then we are in a mess. So it is an exception, not a rule, that we are able to find some tissue pathology which can be linked to the back pain. Many findings may be due to the aging process or normal anatomic variation. Here I will like to look into the cause, risk factors, age. Degeneration progresses with age normally. So many people believe that once there is a degeneration related to age, they must suffer from pain. Every old person must suffer from pain. I think this is a wrong idea. Degeneration, which is related to aging process, is not painful. And degeneration, which is secondary to some cause, is painful. Pain is a protective body reflex which indicates that there is some problem in the body. And the job of a clinician is to find the cause of that pain. Not to give analgesics only, but to find the cause of the pain. And here the problem starts when it tries to find out the cause of the pain. Many findings may be due to the aging process, and they are normal aging process. We can't blame that these are the cause of back pain. Then investigational findings may not correlate the clinical findings, making their significance dubious. Like I'll give the example, like you find an MRI which shows disc prolapse compressing over nerve root on the right side. When you look at the patient, he is suffering from pain on the left side. Now how to explain it? There is no correlation. And once you find a severe degeneration, there is no pain. And I'll quote another study where MRI and X-rays were conducted to the patients who were not suffering from back pain, and many of those findings which are blamed to cause back pain were present in those patients. Now what to say about them? So it is all confusion. Next. In fact, there are a number of studies that have shown adults who are not reporting low back pain having significant abnormalities on X-rays and CT scan and MRI. The results of diagnostic testing for common low back must therefore be interpreted with caution. And you will find the reference, which is in 1994, New England Medical Journal. Next. So, for the management purposes, we divide our patients into 4 groups. Group 1, common, non-specific, non-debilitating low back pain that does not impact activities of daily living. Group 2, low back pain which has become disabling and interfering with activities of daily living. People in this group will seek care. And then group 3, people with demonstrable neurological deficit, motor, sensory or reflex changes suggestive of an anatomic lesion compressing a neurological structure. Then group 4, people with serious and often progressive spinal pathology which can be differentiated in 2 subgroups. The first, likely to require surgery like spinal tumors, infections, fractures, Codd-O'Connor syndrome, and then likely to respond to surgery may become necessary at some time, and these are infection, osteoporosis, ankylosing spondylitis, and rheumatoid arthritis. These are the few conditions of the back pain where we are able to locate the site of pain. Next. Now, the problem lies here. I am more concerned about this area. And believe me, this comprises 90% of the back pain patients who belong to group 1 and 2, where we are not able to make any diagnosis. And these are the different terms which are used in the literature: non-specific low back pain, mechanical low back pain, common low back pain, musculoskeletal low back pain, and simple low back pain. So all these terms are interchangeable and are the same thing, describing that we are not able to find any cause to this pathology. But the patient is complaining of pain, sometimes also complaining of numbness, and sometimes also showing neurological problems. Next. It has been estimated that less than 1% will require surgery, and still 5 to 10% have substantial neurological problem. So every patient suffering from neurological problem have not the solution in surgery. It is only 1/10 of those patients who have diagnosed and any tissue is made responsible for the problem that we are looking at. Only 1%. Next. So the conclusion is that according to the current understanding, it does not appear to be possible to establish a specific diagnosis for more than 90% of patients with low back pain. And this is why I have called it a mystery. With so many advanced technologies, with so many learned doctors, with so many super specialists, we are still staying here. And Australian Acute Musculoskeletal Pain Guideline Group have published this report in 2003. Now I'll come to the KKT area. How KKT is different from the existing scenario. And I'll talk about KKT, I mean group 1 and group 2. Those patients who don't have any diagnosis, or who have there is a diagnosis, but that is a false assumption that disc is causing this problem. Usually you will find, if you look very critically, you will find that the disc is not responsible for all the problems that the patient is facing, but he is showing disc level protrusion at 1 or 2 levels. So that cannot explain the whole picture that the patient is suffering. So I will label it as a future of back care. Why? I'll show you in a few moments. Next. Now just the introduction. KKT is a medical device for the treatment of spine-related abnormalities causing pain. This treatment combines methodologies from physical medicine, rehabilitation, neurophysiology, and clinical biomechanics.